Thank you so much for being here. We're very excited to see so many folks interested in the Mobile Health Impact Accelerator. Um, this session is really meant to go through the background and provide some context to the accelerator and answer some questions y'all have and go through the application process. We're going to start with some quick introductions. My name is Kate Guild. I'm the manager of evaluation and strategic relationships at Mobile Health Map. And I'm also the project manager for the Mobile Health Impact Accelerator. So if you have any questions, please feel free to reach out to me after this session and I'll be happy to answer. I'm going to pass it over to my colleague, Mary Catherine Fallon, if you'd like to introduce yourself, MK.
Sure. Hi. Thanks so much, Kate. I'm Mary Catherine Fallon. I am the Assistant Director of Finance and Operations at Mobile Health Map and the Family Van right here in Boston. And we're really excited to kick this off. And we're so glad that so many of you are here to join us for the info session. And I will pass it over to Molly.
Thanks, Mary Catherine, and thanks, Kate. Hi, I'm Molly Williams, and I'm the Executive Director of Mobile Health Map and the Family Van. And as Kate has said, we're excited to get to share with you this opportunity. And I also want to take this moment to say thank you to the Centers for Disease Control and Prevention for supporting this effort. So, Kate, I'll pass it back to you.
Awesome. Thank you, Molly. And just quickly, if you have any questions throughout the presentation, there will be time at the end for you to ask questions, but you can also put them in the chat and someone from our team will answer you. So let's start. So just quickly, our agenda. We did some introductions. We're also going to briefly talk about Mobile Health Map in a moment. We're going to provide an overview of the accelerator. We're going to talk about the goals of the program and the benefits of the accelerator, why we think you should apply and what you'll get out of the program. We'll go through the eligibility criteria, the application process. We'll talk about some selection criteria that we'll be looking for in your applications, some common questions that we've received, and then we'll briefly talk about next steps and then hopefully we'll have time for questions. Let's get started. Molly, I'm going to pass it over to you to quickly talk about Mobile Health Map.
Great. Thanks, Kate. I suspect that many of you already are familiar with Mobile Health Map because you're here. So that means you probably get our newsletter or you follow us on social media. But for those of you who are new to Mobile Health Map, just a little bit of background. We started as an initiative of the Family Van, the mobile clinic that we operate here in Boston and mentioned in our introductions. And based on our experiences with the Family Van and research that we conducted as part of our relationship at Harvard Medical School, we're all based at Harvard Medical School, we founded, along with the Mobile Healthcare Association, Mobile Health Map in 2009. And together, we work with mobile clinics to measure, maximize, and communicate how we improve health, save money, and advance equity. And I love this work because as someone who operates a mobile clinic, and I can imagine you also have had this experience, I know that this work makes a difference, but I don't always have the evidence. And we live in a evidence-based world. Well, sometimes it's an evidence-based world, but in healthcare, especially, evidence is very important. And so at Mobile Health Map, we are able to, with you, create that evidence to help demonstrate that we are making an impact and that there's value in this approach to healthcare. Next slide. One of the main ways that you may know about us is through the map itself. So if you go to mobilehealthmap.org and click on Impact Tracker, you'll see this screen, and it shows where mobile clinics are located in the US, as well as collectively what our impact is. And if your clinic is not on this map yet, then I have to insist that today, even during this call, I don't mind if you multitask, get your clinic on the map, because this is how we grow the visibility of the field as a whole, but also your visibility as well. We're the #1 search result for find a mobile clinic near me. And so if people are Googling mobile clinic Minnesota, you want them to find you. And this is one way that you can help ensure that people are finding you, especially funders, policymakers, public health leaders. Make sure you get signed up. And then the next step is to confidentially share your data with us so that we can compile it into our national statistics of the difference that mobile clinics are making. There's a number of other ways that we serve the mobile healthcare sector. It's this map, the tools that we offer to help you measure and communicate your impact, but also one-on-one and small group support. And this is just one example of the kind of small group support that we offer for mobile clinics to accomplish a certain goal. And you'll hear more about that goal today. So again, thank you for being here. If you, like I said, you probably follow us on social already and get our newsletter because you heard about this webinar. But if not, I encourage you to follow us on LinkedIn and Instagram, and to sign up for our newsletter at mobilehealthmap.org. So thanks again for joining us, and I'll pass it back to Kate.
Thank you so much, Molly. And if anyone has any difficulty joining the map, please feel free to reach out. My contact information will be at the end of the presentation, and we'll also follow up with an email. So you'll have my information that way as well. So just jumping into the Mobile Health Impact Accelerator, we're very, very excited about this opportunity. It's a 6-month learning and capacity building opportunity for staff of mobile clinics. And we're offering skill building, technical assistance, and peer support to strengthen clinic services and enhance community connections. And when we say technical assistance, we really mean that we'll be working one-on-one with you throughout the course of the accelerator to help you with the unique needs that your program has. So that's what we mean with that term. Like Molly said, we're very grateful to the Centers for Disease Control and Prevention, the CDC, for funding this the accelerator. And we received this funding as part of a national effort to strengthen the public health system and improve health equity. So throughout the application and throughout the description of the program, you'll see a focus on connections with the public health system and health equity. So who should apply? Like I said, the program is for mobile clinics. We're looking for mobile clinic teams that are interested in improving their service delivery, the sustainability of their program, and aligning their programming with public health strategies. It's ideal for clinics that are aiming to better understand and address the healthcare needs of their communities, and connect with their communities in that way. The format, there will be virtual meetings held on a monthly basis with a blend of group learning in those meetings, as well as the one-on-one technical assistance and support. And then we're also going to be asking for some independent work to be done in between those meetings. So the goals of the program, we really hope to help you build skills and learn some new strategies and tools. You'll gain essential skills in needs assessment, program evaluation, and data analysis. You'll also learn how to use these skills to identify community health needs and use that data to guide your decision making. Another goal is to strengthen public health connections, which I mentioned is a big focus of this opportunity. We hope that we can create and deepen partnerships with local public health systems and help you learn strategies to bridge gaps in care and integrate with broader public health initiatives to better serve your communities. We also hope that the accelerator will help improve service delivery. We will assist in applying proven public health strategies to enhance the effectiveness and sustainability of your services. The accelerator encourages you to learn best practices to adapt your services to respond to the unique needs of your community by fostering those connections. And through all of that connection building and relationship building, we hope that you can build community trust and engagement. So you'll develop approaches to build lasting relationships with communities, especially marginalized and underserved populations, with our focus on health equity. And there will be a large focus on building trust, which we believe enhances the reach of your services and the impact of your services in underserved areas. So the benefits of the program, really, why do we think you should apply and why do we want folks to participate in the accelerator? So we're hoping that you will develop skills and gain knowledge. You'll have access to expert training and support, specifically on conducting needs assessments, program evaluation, data collection and analysis, and decision making. You'll also learn how to gather, interpret, and act on community health data to make your services more targeted and impactful for the communities that you serve. You'll receive personalized technical assistance, so we'll meet with you one-on-one monthly. Mobile Health Map staff will meet with you, and those sessions are specifically tailored to your programs, the challenges you're facing, and the goals of your programming. And this ongoing support will ensure that participants receive guidance that's tailored to the unique needs of your clinic. You'll also gain access to a network of peers, and you'll hopefully create a really supportive environment to learn from other mobile clinics across the country that are facing similar challenges to you. These monthly group sessions and optional office hours will provide opportunities for you to learn from each other, share insights, strategies, and resources. And then finally, there will be a strengthened public health collaboration, which again is a big focus of the accelerator. We're hoping that you will develop stronger, more coordinated relationships with local public health systems, and you'll learn to align your efforts with public health priorities to create a more sustainable and impactful community health solutions. And finally, if maybe one of the most important is you'll build community trust. So you'll learn strategies for community engagement that foster trust, that ultimately enable better outreach to underserved and marginalized populations. And hopefully you'll build long-term relationships with community entities and public health systems that strengthen your role as a trusted healthcare provider in your community. So who's eligible to participate? We ask that you're currently operating a mobile clinic and or have a mobile program. We are asking that your mobile program has at least one dedicated staff member. And this is part of our criteria because we want to make sure you have the capacity to fully engage in this work. Um, we ask that your program is registered with Mobile Health Map. As I said earlier, if you're not on the map, we'd love to have you on there. And I'm more than happy to help you get on the map if you have any challenges with that. Your mobile program has to be based in the United States, its territories, and/or tribal nations. Your mobile program or its parent organization is a charitable nonprofit organization. And we're also asking that two representatives from your organization are available to attend all of the scheduled learning sessions. And this is to just ensure participation and make sure that we have a continuity throughout the program. So the application process, we have an online form that is linked here. You'll have access to these slides after this session. And on the newsletter that was sent out, there's also a link to the application. So you can fill out the application there. And just some key dates for the remainder of the application process. We're having question and answer office hours November 8th and then November 19th. And these are an open space for you to come and ask any additional questions that might not be answered today or might come up as you're looking through the application. So I'll be there and I'm happy to answer any of your questions in that capacity. You can also reach out directly to me if you have a question. I'm happy to answer over email. The application deadline is December 6th. We will have decisions and notify applicants by December 17th. And the program, the first session of the accelerator is on January 9th, and the final session is in June of 2025. The selection criteria, really, what are we looking for when we're looking at your applications? and reviewing the applications. It's really important that you exhibit a commitment to community engagement. So we're looking for applicants who demonstrate a strong desire to connect with their communities and local public health systems, and a desire to better understand and serve their communities, an emphasis on willingness to engage in needs assessment and build partnerships to identify and address community health needs. Similarly, we're looking for a commitment to health equity. We're looking for a demonstrated dedication to advancing health equity and reaching underserved and or marginalized populations, and an interest in applying evidence-based public health strategies to reduce health disparities. And with these in mind, like things like needs assessment and interest in needs assessment and public health strategies, you don't have to know um, much about needs assessment or specific public health strategies. That's all material that you'll learn throughout the accelerator. We just want to see the expressed interest in utilizing those strategies to strengthen your reach to your community. And then we want to see an alignment with our goals of the accelerator. So we're looking for clinics whose objectives align closely with the accelerator's mission to improve community health, expand access, and strengthen public health collaborations. It's also important, like I mentioned earlier, that you express capacity and readiness to participate in the program. So we're looking for folks that are ready to fully engage in program activities and commit the necessary resources over the course of the 6 months. And we're also looking for folks who can have 2 representatives participate consistently in all of our sessions. And again, this is important because there will be some work outside of the sessions, and we want you to be able to get the most out of this experience and really be able to put in time and energy to receive that full impact. And then we're also looking for potential for growth and sustainability. We know sustainability is really important. We want to be able to provide tools that will help you build sustainable and impactful services through utilizing data-driven approaches. And we're also looking for an openness to adopting new strategies, to learning new strategies and learning from your peers, and learning new practices throughout the accelerator. So some frequently asked questions. I've talked about this time commitment a few different times. So we're expecting you to spend 4 to 6 hours per week on independent work, plus the 1 monthly group session, which will be an hour and a half each month, and then a one-on-one technical assistance meeting with someone from the Mobile Health Map team, which will be an hour. And then we'll have optional office hours as well that you're able to join if you'd like, but you don't have to. Can multiple staff members participate? Yes, we are encouraging 2 representatives from each organization to attend all of the sessions. I touched on this a little bit, but what if our clinic hasn't conducted a needs assessment? There's no requirement that you have experience with needs assessments or conducted a needs assessment. We're going to guide you step by step through the process. So there isn't prior experience needed. There's no cost to participate in the accelerator. And just reiterating, we are providing monthly one-on-one technical assistance. You'll receive support through a peer network, and you'll also have access to resources and public health strategies that we develop with you throughout the course of the 6 months. So just a reminder for next steps, we have the Q&A office hours on November 8th from 10 to 11 a.m. Eastern Time, and then on the 19th from 2 to 3 p.m. Eastern Time. And again, if you have any questions, you can feel free to reach out directly to me by email or phone, and I'd be happy to walk you through those questions. So that is all that we have planned, and we have plenty of time for questions. So I'm going to.
Hey, there was one question in the chat. Is there a way to preview the full application? Because I know it's in FormStack. So I believe that we can download the application and have people see it.
Yeah, absolutely. We can definitely do that and send that out to folks on the call. Let me
Yeah, and I
stop.
believe all the questions that are in the application are also listed in the call for applications. So if you use the first link that I posted, that'll take you to where you can download the call for applications, and you can read the questions there. But we can also create a copy of the form so you know what you're going to see in Form Stack and share that with you.
Thanks, Molly. Yeah, and these are great questions in the chat too. I'll just read a few out. Let me stop sharing so I can see folks. Okay. Um, there are no requirements on degrees or certifications for the folks that can participate. We encourage anyone that's interested in the program to apply. And let's see. What if the participating staff no longer works the organization or work in a different capacity? Hmm. Sophia, would you mind sharing a little bit more about your question?
Yes, no. So I was just wondering, so the two dedicated people, if during the initial like 6 month program, if I'm the staff member and if I get a promotion or I move to a different department and I'm no longer working with mobile clinics and someone else fills my position or there's someone else within my office, could they fill in for me?
That's a great question. I think if there's we would like to see folks continue through the program because it is a learning um, opportunity and you're going to learn. It's very iterative in the skills that you're going to learn. So I think we would prefer that the two folks that originally join are able to stay throughout the 6 months. But Molly, I don't know if you have additional thoughts. Saw you come off mute.
Yeah, I mean, I think you said it right, Kate, that our preference is that both people stay the whole 6 months, but we also know that life happens. So the benefit of having two people is that if one person gets pulled away, you could backfill their role in the group. We just want some continuity throughout. So that's really the purpose of having two people. Um, I also recognize that for some of your institutions, there may be folks who are directly involved with the mobile clinic and other people in the organization who support things like needs assessment and evaluation, not just for mobile, but for all the programs. And they would be welcome to participate as well. We do want someone who's coming who knows the ins and outs and is very familiar with the mobile program. But I also recognize that some of you may be split and have multiple roles within your organization. We all wear lots of hats. So that could also be a way to bring in other people from the organization who are interested and want to learn more about needs assessment and can apply those skills to the mobile clinic.
Thank you.
Yeah, great question, Sophia. Thank you, Molly. I see another question here. Are there deliverables associated with this project? There are. So through completing the accelerator, you will actually complete a full needs assessment. So you will have that, and something that we'll talk about in the accelerator is your deliverable really should reflect your needs and the community's needs. So it might not be the same for every program that's involved, but there will be some form of report, for lack of a better term, that kind of highlights what you've discovered in your needs assessment and how it impacts your program plan moving forward. But that could be everything from a slide deck to a formal report to a community meeting. It really can range depending on your community needs and your program's needs. I see a question.
Thanks, Kate. Yeah, there's a follow-up to that one about a plan to include the dissemination conferences or publications.
Yeah, so similarly, we're going to have everyone report back at the final session. It's going to be slightly longer. It's going to be 2 hours, and you'll have time to share your findings with the group. But we strongly encourage you to disseminate your findings with your community. And if you're interested in disseminating further, that would be something that we could work on you one-on-one during those TA sessions to talk about what that might look like and how we can support that.
I was checking to see if you'd seen my question on the chat.
Yeah, so is there any assistance or advice in getting a mobile clinic started? So that's a great question and a question we get often. I would actually, we have some resources that I can definitely share with you, Ashton, if you want to reach out to me directly by email. I also highly recommend looking into the Mobile Healthcare Association. They have a lot of resources for folks that are just getting started and can answer a lot of logistical and practical questions that tend to come up for clinics that are just getting started.
Okay, and what is your email?
Yeah, I'll put it in the chat for everyone.
Okay, great. Thank you.
Of course. Does anyone else have any questions? Great. Well, we were very excited again to see all of you and to see such strong interest in the accelerator. We think it's a great opportunity that we're very excited to share with y'all. Please, like I said, oh, could you speak a little to the weekly commitment of, I believe, 4 hours? Yeah. Um, so the weekly time commitment, we're expecting to be about 4 to 6 hours. And that's because a needs assessment is a very involved process. That time could be everything from meeting with folks to conduct interviews or focus groups. It could also be time spent scheduling those interviews and focus groups, analyzing the data that comes out of your data collection, creating your final deliverable or product. So it really depends program to program, but the reason we call that out is because we want folks to know that it is an involved process and it will take time outside of the sessions that we have together. So yeah, that's a great question.
Hi, this is Kristen Macy. I just posted that question.
Yeah.
So just to expand on that a little bit,
Mhm.
I'm not certain if my organization will be able to commit that much time right now, given our staffing. I think it's something we're still very, very interested in, and I think we need to think about a little bit how we would be able to commit to carving out that time.
Mhm.
I think we would have to really make sure leadership supports us in carving out that time. So that would be a priority for us before we do apply. But if that's not able to happen right away, will this acceleration program be offered again? And if so, we would, consider applying at that time. When would you foresee that? Is that, when this 5-year plan ends, or is that maybe in a year? So I don't know that we would want to wait 5 years if it's going to start in another year. So if you have that information, I think that would be great. If you don't, that's okay. I certainly understand. We just want to, maybe learn a little bit more about that.
Yeah, absolutely. That's a great question, Kristen. And we're very lucky. Our funding from the CDC is actually over the course of 5 years, and our goal is to conduct an accelerator or some sort of learning opportunity annually. So there will be another one in a year. The focus might be slightly different. However, it's still going to be focused on evaluation, very community grounded, focused on building partnerships with public health systems. So there will be other opportunities. We understand that mobile health programs tend to be understaffed and are working very hard on a daily basis, as we see with our program in Boston. So, yeah, I appreciate you bringing that up, Kristen, but there will be other opportunities as well.
Okay, thank you for that. And then the other question that I would like to ask is, we're a very large health system in Pittsburgh, and we have several departments, which we call institutes within our healthcare system, like primary care has an institute, pediatrics has an institute. We have several that have mobile units. If one of our other departments would take part in the acceleration program, at a later time, would a different department, because we're not we're not aligning our efforts all that well right now, which is one of the reasons that we're interested in being part of the accelerator. But if we're still not there, would another department be able to enroll in a year or 2 years?
Yeah, that's a great question. I'm interested in I think if you work separately, and your different mobile programs, then that should be okay. Um, but that's
Like
something that we could
specifically, so it would be. So I'm primary care, but my unit covers primary care and pediatrics. We have another department that focuses strictly on um, STI prevention and focusing on the homeless and unhoused population and people who are coming directly out of incarceration, like they wait with the mobile unit right outside of the jail. So their efforts are very, very different than the work that we are doing, focused on older adults with chronic conditions, right? So that's why some of the work we're doing isn't really intersecting quite yet.
Right.
So that's
Yeah. Yeah,
so
I
it is
think
very different. Hopefully we'll align at some point, and we are working on that. But yeah, okay, I see the explanation here. Thank you.
yeah, and I think because your communities are pretty drastically different and the needs you're addressing are different, it would definitely be something that we could talk about and consider in the future.
Thank you.
Yeah, of course. Molly, so you have your hand raised.
Yeah, thanks, Kate. I was just going to add that in addition to the accelerator, as part of this program, we'll also be offering a series of webinars for anyone who is interested, regardless of whether you're part of the accelerator. So this is just one of many learning opportunities. So if you don't apply to be a part of this accelerator, or you're not selected this time around, there's still going to be ways to get involved and to learn, both in terms of additional webinars we'll be hosting for that are open to everyone, as well as a resource hub that we're going to create and make publicly available on our website. So many of the materials that we develop and share for the accelerator will be available to anyone and everyone. So that I hope for those of you who don't participate this first time can benefit from those materials down the road once they're available to be shared.
And as Molly mentioned, we also do work closely with programs one-on-one in other capacities. So you can always reach out to us if you um, have more questions about that kind of work, and we can talk about that. Do you have a limit of how many organizations? Yeah. Thank you, Mary Catherine. So 12 clinics will be chosen for this first round of the accelerator. Any other questions? We have time, so I will stay on for a bit longer if anyone has any lingering questions. But we'll follow up, like I said, with an email with the link to the full call for applications. You'll have my contact information so you can reach out directly to me. You'll receive a copy of these slides, and we'll also just write up a quick document with all the questions that were asked and answers to those questions as well.